Our next speaker is Kate Loranger, who is a genetic counselor at UCSF, and we are so pleased that she's going to talk about some of the implications around genetics and breast cancer. And if you're coming up with a question for her, please look for your yellow card to write that down. Welcome, Kate.
Thank you, Margaret, and good morning, everyone. It's a pleasure to be here this morning with you all. As Margaret said, I'm a genetic counselor at UCSF, and today I will be speaking with you about genetic counseling for hereditary cancer syndromes. As a genetic counselor, our focus is really on the prevention of cancers in families who have a higher risk due to inherited factors. And we get referrals for patients based on several different factors. Sometimes it is because a woman is diagnosed with a cancer at a younger age than we would expect, or a woman may have been diagnosed with more than one cancer in their lifetime, or there could be a rare cancer. Other times it's based on family history, so there may be a pattern of cancers in a family that includes multiple generations and multiple people with cancers diagnosed at younger ages. And a lot of people ask the question, why would I want to know? And I think that's a really important question, and that's where our focus comes in on prevention. Our goal in a family is to help people understand how they can prevent cancers through things such as increased surveillance for cancer. People also want to know because they want to understand what the risk is for their relatives, for their children, their siblings, other people in the family. So that's another reason why people come in and speak with us. As you can see from this pie chart, most cancer is actually not hereditary. And so a little less than 3/4 of breast cancers are not hereditary. They're what we call sporadic. And so it's something that happens by chance, and it's not due to factors that were inherited in a family. But about 10% of the time, breast cancer actually is due to an inherited factor, or what we call hereditary. And in these families, like I mentioned before, the history is striking in that there may be multiple generations that are affected with the same type of cancer or a related type of cancer. And it can also be that the ages at which the diagnosis occurred is younger than expected. And then there is this category that we call familial cancer. And that is where we haven't identified a particular hereditary cancer syndrome. It doesn't seem that there's a single gene that's mutated in the family. But we do see that there might be a moderate increased risk for cancer in that family. And this is probably due to a combination of some smaller, lower risk genetic factors in combination with environmental factors. So in families with hereditary cancer, we know that there is a significantly increased risk for cancer. But in those families with a familial cluster of cancer, the risk might be more moderate. But in both cases, there are recommendations we can make for the family that personalizes the recommendations for cancer screening and prevention. And so genetic counseling is really an interactive process between the genetic counselor and the patient who comes in. We want to better understand what someone's concerns are in their family. And we want to couple that with education about hereditary factors, about how cancer can be inherited in a family. And so we spend time talking with patients about inheritance patterns of cancer, about family history. But we also want to address the very strong emotional concerns that come with this, because going through the process of genetic testing is not an easy decision, and it can carry a lot of difficult emotions with it. And so we are there to address concerns from both the scientific genetic testing side of things as well as the emotional side of things. And as a genetic counselor, the biggest tool that we use is the family history. And that's why it's really important to try to get a pretty accurate family history, which isn't always easy. But, by calling family members and getting more information from relatives, it really helps us a lot to have an accurate sense of the family history. And by that I mean knowing the primary site of the cancer, where a relative's cancer originated. And a big one for us is actually knowing the age at which the cancer was first diagnosed, because that age piece of it plays a really big role in our assessment. And then we also look for what we call dominant inheritance pattern. And a dominant inheritance pattern is where we see more of a vertical transmission of cancers in the family. So from one generation to the next, we are seeing cancer being diagnosed in a family. That's one of the red flags for us, that there could possibly be a hereditary cancer syndrome in the family. And so this table lists several of the hereditary cancer syndromes where breast cancer is a component. And I think a lot of times in kind of the popular media, the BRCA1 and BRCA2 genes get the most airtime, and they actually are the most common cause of hereditary breast cancer. So that is certainly true. However, there are other hereditary cancer syndromes and other genes that involve familial or hereditary risk for breast cancer. And so as a genetic counselor, the reason why it's so helpful for us that somebody get a very accurate family history is because it can help us determine if there might be another syndrome besides BRCA1 and BRCA2 that we would consider testing for in a family. And so each syndrome has an associated pattern of cancers. As the name implies, hereditary breast and ovarian cancer syndrome, which is due to mutations in BRCA1 and 2. We primarily see breast and ovarian cancers, although there are other cancers that can be seen as well. And then in some of the other syndromes, we see a completely different pattern. For example, seen in some families, we see breast cancer along with thyroid cancer of a specific type and endometrial cancers. And that would make us think about a different syndrome that we call Cowden syndrome, for example. So looking at the family history, looking at the pattern of cancers really helps us determine, first of all, if genetic testing is even recommended for a family, and secondly, which genes we would consider testing for. And genetic testing has really evolved quite a lot in the last 5 years. And even before that, there were improvements. So I just wanted to highlight the fact that genetic testing for hereditary breast and ovarian cancer syndrome, which includes testing of the BRCA1 and BRCA2 genes, has gone through some improvements over the years. So our ability to detect mutations in those two genes first underwent improvement in 2002. And then again in 2007, our ability to pick up mutations in those genes got better as well. And so some women who had genetic testing years ago may not have had the most comprehensive test available. And so if there remains a strong pattern of cancer in that family, it may warrant talking to a genetic counselor again to determine if someone's had the most accurate testing. Beyond that, now that we have more genetic testing for some of these other syndromes, it may be that even though BRCA1 and BRCA2 genetic testing was negative, if there's a specific pattern of cancer in a family, we may consider doing more genetic testing than we would have 5 years ago. So it's always something that we can revisit since our field is evolving quite rapidly. And so I just wanted to highlight some of the main features of hereditary breast and ovarian cancer syndrome, again, because it is the most common cause of hereditary breast cancer. And as the name implies, when we see a certain type of ovarian cancer, what we call an epithelial type of ovarian cancer in a family, it raises a red flag for us about the possibility of hereditary syndrome. We also look out for early age of diagnosis, as I already mentioned. We look to see if anyone has had bilateral breast cancer, because that can be a feature of this syndrome. We look at someone's ethnic background to see if they're maybe from a region of the world or a population where mutations are more frequent. Male breast cancer is another area where we would want to see any men diagnosed with breast cancer just because it is less common. And if there are 3 or more cancers on the same side of the family that include breast, ovarian, or pancreatic, then that is a family that we would want to talk with to talk about the option of doing some genetic testing as well. And so just to revisit this family tree, what we see in this family is the woman who was referred to us was actually the woman who was diagnosed with breast cancer at 45. So given her young age, she came in to meet with us. And in taking her family history, we noticed that there were some additional cancers in the family. A brother was diagnosed with prostate cancer at the young age of 55. So prostate cancer is common, unfortunately, in men, but it's something that tends to happen a bit later in life. And so that age of 55 raised a little bit of a red flag, as well as the fact that their father had prostate cancer as well. So we had 2 generations of prostate cancer. But even more striking was the fact that there was both breast and ovarian cancer history in her family. And so one of her father's sisters had ovarian cancer, and her father's mother had breast cancer. So when we put all of this together, the history of early breast cancer, breast and ovarian cancer in the same side of the family, as well as early prostate cancer, it was enough to consider doing genetic testing for the BRCA1 and BRCA2 genes. And in fact, she was identified to have a BRCA2 mutation. And so the family history is really helpful in determining the path that we take in terms of genetic testing. But we also recognize that sometimes there isn't a family history. And so this woman was diagnosed with ovarian cancer at a young age, but was really not thinking that she could be at increased risk for breast cancer, because really there was no family history of that in her family. And it was a very small family. And so sometimes what we see is that there's a limited number of females on one side of the family. And so her father was an only child, and his father was an only child. So that whole paternal father side of the family, there were no female relatives. And so sometimes there can be a hereditary cancer syndrome coming from the father side of the family, or a side of the family where there just aren't many relatives, and it can mask a hereditary cancer syndrome. So, an astute physician just recognized the fact that this ovarian cancer was diagnosed at a younger age than would be typical, and referred anyway, despite the fact that there really wasn't a family history that was concerning. And so when we identify a family that is at increased risk for cancer due to an inherited factor such as BRCA1 and 2, there are several different options that we have to help those families. As I mentioned before, increased surveillance becomes very important. So individuals with inherited risk for breast cancer are recommended to undergo routine breast MRIs in addition to mammograms every year. We also do increased or more frequent physical breast exams as well in those individuals. And sometimes an individual may even choose to undergo some type of risk-reducing surgery. So a woman who finds out that she has an elevated risk for ovarian cancer, who's maybe done having children, may choose to have her ovaries removed to prevent that cancer down the line if she knows that she has an inherited gene mutation that puts her at a higher risk. These are very difficult decisions that patients and families have to make, but there are options, and it can give people hope in terms of cancer prevention. And then there's also the option of doing chemoprevention, meaning taking a medication or a drug that can help lower the risk for cancer in the future. For example, taking tamoxifen in women who have a BRCA1 and 2 mutation as a preventive measure for future breast cancers. And so, there are options that women have, and even men have, who are identified to have a hereditary cancer syndrome. And it can also be very informative for family members as well. And so that's all that I had. Thank you for your time.